Hello everyone. My name is Dr.Advait Kulkarni. I am a senior consultant neurologist practicing in Bangalore at my own clinic, HSR Neuro Clinic, and I am a visiting consultant at Manipal and Narayana Group of Hospitals. Doctor, I am feeling that the whole room is spinning. What is the reason? This is a typical question a patient with vertigo comes with. Vertigo means spinning sensation. The person may experience himself spinning or the surrounding spinning. This spinning can be associated with nausea, vomiting, or inability to walk because of the imbalance. Typically, the vertigo which arises from the ear lasts only for few seconds. That is called positional vertigo, benign positional vertigo. And a vertigo which is very severe, which lasts for minutes to hours, relentlessly, continuous with repeated episodes of vomiting, can be vestibular neuronitis. So it is important to recognize your symptoms and meet your neurologist to get yourself diagnosed whether the vertigo is coming from the ear or it is coming from the problems in the brain. Like in elderly population or people who are having risk factors like hypertension and diabetes, smoking may get a stroke in the small brain, a clot in the small brain, which may lead to this symptom of imbalance and spinning sensation. Those patients also will complain of dizziness and imbalance. And these are the times which we need to recognize immediately and take these patients to the emergency department. Because if it is a stroke or a clot in the brain, the treatment is very well possible if you reach within 3 to 4 hours of the onset of symptoms, because time is brain. Once the neurologist tells you what is the root cause of vertigo, if it is coming from the inner ear, that is a benign positional vertigo, there are certain manuals like Epley's manual, which will be done by your ENT specialist or a neurologist. And most important thing is, in certain cases, we need to do advanced tests like vestibular nystagmogram, the vertigo assessment, or brain imaging in very few patients. It is very important to understand that vertigo can be very well prevented. How to prevent vertigo? Most important thing is to have a good night's sleep. If you sleep late, you are more prone for getting dizziness and these vertigo symptoms. So try to follow the biological clock. Try to sleep by 10 o'clock or 10:30 in the night and try to wake up early. Obviously, if you sleep by 10 o'clock, you might wake up by 6 or 6:30 in the morning. Follow the biological clock. Synchronize your food timings as per the sun. Do not have very late dinner. Be moderate in exercise. Do not over-exercise. And eat well when you're hungry. Do not skip your meals. Do not eat very less. Or do not simply drink tea, coffee, juice when you're hungry. That is very, very important. Not in just case of vertigo, but also in case of migraine. Even some patients of migraine may experience vertigo or dizziness, which is called a vestibular migraine. So it is very important to visit neurologist and get yourself treated and understand how vertigo can be treated immediately with medications as well as different manuals.